Anti-aging bundles. Today we're going to be talking to women of a certain age dealing with problems of perimenopause and menopause and some solutions to those problems. First of all, the main problems of aging and menopause, perimenopause are looking old and feeling old, and no one wants to be like that. Hello, I'm Dr. Murray Riggins. Do you know women who basically, or someone you know or love, who have symptoms of hot flashes, who suffer with saggy skin, um, mood swings, low energy, loss of libido? Well, today we're going to talk about two solutions to those symptoms. And what I do in my practice here in Gadsden, Alabama, medical aesthetic skincare, Dr. Riggins Mask, is that we basically help people feel better. I am a natural born healer. It's what I do. It's my assignment here on planet Earth is to pump positive healing energy into the world, and I do it with joy. I enjoy it because it makes me feel good to know that I'm helping so many people. I love feeling good. And even away from medicine, I love having a good time. I love hanging out with the stars and the musicians. I too am a musician. In fact, you can check me out on YouTube, Riggy Rock, the Funky Doc. But I believe in having a good time. In fact, one story, I was actually in a movie, Tango and Cash, years ago. I was on the set with my favorite action hero, Sylvester Stallone, at the time. And it's a great story. In fact, I'll tell you about that a little bit later. But that same zest that I have for having a good time, I also have that zest when I'm collaborating with great medical minds, other doctors, and other people in general who are engaged in the process of helping people feel better, look better, be better, enjoy their life to the fullest. People like Dr. Oz, America's doctor. People like Lee Perricone, he's big in cosmetics. People like Christiane Northrup, she's big in women's health. And people like Montel Williams, who's a great inspirer and motivator, and he's big in CBD oil. And I'm a great proponent of CBD oil, and it helps us to live a better life too. But today we'll be talking about basically menopause. What's the main problems? What is menopause? Well, menopause is when your body stops making sex hormones. Now, if your body decreases making sex hormones, as it typically does as you get older, then you're in perimenopause. In general, hormone production varies throughout a woman's lifespan, from birth to about peaks out at about 20, 28, 24 years old. Then around 38 is a lot less, 48 is a lot less. That's when you start getting perimenopausal symptoms. And typically, that's when a lot of people say, oh, life is downhill from there. But not necessarily the case. There are problems associated with menopause, perimenopause. The main problem, of course, hot flashes, the dreaded hot flashes. They hit without warning, make your life basically miserable. You just all of a sudden, out of nowhere, you just start sweating profusely, without uncontrollably. You find yourself out at a function, you're eating dinner at a fine restaurant, hot flashes hit, and all of a sudden you have to fan yourself with the menu. It's very embarrassing, uh, frustrating, and a lot of people say, "Well, just deal with it." Well, it's hot flashes won't kill you, but it definitely makes your life a little bit less pleasurable. Okay, and there are many other symptoms associated with menopause and perimenopause: night sweats, insomnia, vaginal dryness. Okay, which leads to painful sex, which leads to loss of libido. If it hurts when you have sex, you try to stay away from having sex, which is hard for your partner to understand sometimes because they're not aware of what you're going through in your body, what you're feeling. And you get that leads to depression, anxiety over being that cold fish your husband comes home to or your partner comes home to from the office, and he tries to get sensual, sexual embrace, and you're shying away, so they feel rejected. Uh, you also have increased back pain and memory and concentration problems. You forget Now, what is it that I came in this room to do? And basically, a lot of doctors just don't listen. Um, they say it's just aging. They say just deal with it. Take a Xanax, you'll be okay. And then there's the dry, floppy vagina, which leads to more vaginal dryness, because we know people who have had multiple vaginal childbirths, their vagina doesn't snap back to the same tightness as it was before. And then you add that to the whole decreased libido thing, and it's just a it's awful, and it ends up sapping your whole mental state of mind. I mean, doesn't every woman want a tight, moist vagina? Well, now you can have one again, because what happens, you find a lot of couples who've been married 30 years, and they suddenly their relationship sort of drifts away, and they end up getting a divorce. And you have to ask yourself, why if somebody's been together 30 years now decides to get a divorce? Well, there are things going on in both their bodies that they don't speak on, they don't understand, they don't talk about, and they interpret it totally wrong. The man thinks the woman doesn't want him because she's shying away from sex. The woman thinks the man is not interested in her because he might be shying away from sex. Because just like women have menopause, men have andropause, low testosterone, low libido, low energy, same type of things. So what happens is everyone feels they're no longer wanted or needed, and they have to look outside the marriage to get that validation, therefore divorce. But if we could fix that, if we could fix the hormone levels such that they're back to the levels they were in your 20s and 30s, that would be solved. You would still have that desire, you still have that energy, you still have that increased libido. Well, bioidentical hormones is the answer. Bioidentical hormones is different from synthetic hormones. Synthetic hormones are made by drug companies, and they're based on the molecular structure, or what we call the blueprint, of a pregnant mare's urine, which is great for horses, but not that good for humans because they have a lot of side effects, from blood clots, strokes, increased heart attack incidences, just from taking these synthetic hormones. However, bioidentical hormones have the same molecular structure or blueprint that the hormones your body used to make has, and consequently, your body recognizes them, works with them, and you don't have those same side effect profile. Bioidentical hormone pellets are about the size of a grain of rice. We end up making a tiny little incision in the back of your butt after we numb it up with lidocaine, of course. We put the pellet underneath the skin, put a band-aid on top of the incision site. Once the pellet is inside the body in the fatty tissue layer, the blood that flows across the pellet causes the hormone inside the pellet to leach into the bloodstream. Now, the next problem of aging, man, that saggy skin. What to do with the saggy skin? What happens is, as we age, your body just stops making collagen. Collagen is to skin what air is to a balloon. So if I were to blow up a balloon, get it nice and tight, tie it up, leave it in the corner of the room, come back in 3 days, some of the air would have escaped. The balloon wouldn't be as tight, it would be a little soggy, saggy, similar to your skin with decreased collagen. So, we understand that with aging, perimenopause, comes saggy skin. But the problem is solved with Tempsure Envy, a new radio frequency skin tightening technology. It's the coolest thing ever. Check it out.
The Tempsure Envy treatment is a gentle way to revive skin's natural beauty and reduce the appearance of facial wrinkles and fine lines. Treatment begins as a gel is applied to the skin. Radio frequency energy is delivered, and the device massages the skin in small circular motions. Tissue resistance to RF energy at the dermal-subdermal junction causes an increase in temperature. This temperature is modulated by the Tempsure system to safely maintain the skin at appropriate levels. As the skin temperature increases during the procedure, collagen is stimulated and mild edema occurs. Once the procedure is complete, the skin temperature drops back to normal. Facial wrinkles may seem less visible for 2 to 3 days after treatment. At 7 to 10 days post-treatment, the rebuilding process begins in the dermis. Fibroblasts accumulate to synthesize new collagen and elastin. Tissue growth factors are released. At 25 to 30 days post-treatment, new collagen and elastin synthesis decreases fine lines and wrinkles. Tempsure Envy, beautifully intelligent RF technology.
And here are some before and after pictures of the effects of the Tempsure. And I have to give a shout out to Dr. Daugherty and Dr. Khalil for those. Now, this is the best gift ever. Okay? Think about it. We have the pellets for the hormones. Replace those and get your levels back. Turn back the clock 20 years. We have the Tempsure Envy to tighten the skin, whether it be on your face or even the same procedure or the same technology can help with the vaginal tightness. It helps with urinary incontinence. And all that together, it's like the best birthday, Valentine's Day, anniversary, Christmas, and Mother's Day gift of all time, all rolled up into one. Okay. This gift will help you look and feel better than you have in 20 years. You said, well, what's the gift? What are you talking about? Well, some women pay $7,000 to $20,000 just to have a surgical face and neck lift. That's just how much they value looking good. And that's cool. But how about looking good and feeling good? How much was that value? How much would you value? How much would you pay for that? Well, our new anti-aging special package consists of 4 bioidentical hormone pellet treatments, which is that's the amount for a calendar year, one every 3 months, plus 4 radio frequency skin tightening treatments, any combination, face or vagina, for those. If you try to get those 4 costs a la carte, or 4 procedures a la carte, it would cost $5,360. But here's where it gets good. These same treatments, the bioidentical hormone pellet treatments, plus the radio frequency skin treatment, you get for not $5,000, which would be a nice little $300 discount. Not $4,000. Not even $3,000. What? Yes. For this special, you get a year of these services to help you not only look good, but to also feel good for only, ready for it, drum roll, $2,750. What? Did you hear this? That's right, $2,750. The offer expires October 31st, 2019. So the only question that's left to ask yourself is, am I worth feeling good and looking good? If you have any questions, go to mymask.com and get more information about the services. Listen to the page that talks about Patients Are Talking, where patients give audio testimonies to how they feel after they got these services. Are you worth it? I think you are. Call 256-438-6494